Welcome to Her Side of Campus, the show where ideas spark action and voices ignite change. I'm your host, Komal Iqbal, and today we're diving deep into a conversation that just might change the way you see the world. I'm joined by Chelsea Agbasiere, an alumni who has been through multiple challenges with her period health. Today we're raising awareness about the conditions that affect women, such as fibroids, endometriosis, PCOS, and other issues that women face. We'll also be talking about the events that she has planned with me to raise more awareness about this cause. Hi, Chelsea.
Hello, everyone. Thank you, Kamal, for putting this together. Just so you know, I'm very, very proud of you, especially all the things that you've been doing for the women across the campus, across Bradford, and beyond. I'm so proud of you.
Thank you. So I wanted you to introduce yourself, tell us a bit more about what you've been through and how it's affected you.
Okay, so my name is Chelsea Agbasiere, just like she has introduced me, and I have been very, very passionate about the causes of women and girls across the UK and also across my country, Nigeria. On this episode, I'm going to be talking about all the issues I've faced, especially when it comes to my menstrual health. First of all, I discovered in the year 2020 during the COVID-19 pandemic that I had fibroids. And how did I discover this? So I found that during the COVID-19 pandemic, during the lockdown, that when my period came, it refused to stop. So it ran along for like 16 days. And on that 16th day, I drove myself to the hospital. And in as much as there was lockdown then, so the police kept stopping me on the way and asking me what the problem is, where I am going. And I said, I'm really going to the hospital. And I was crying. And they were so nice. They escorted me to the hospital. And on getting there, the doctor asked me what the problem was, and I told him my period has been on for 16 days, and he was so shocked. And he said, okay, I need to examine you. What's this problem about? I really need to send you to an emergency pelvis scan because there's probably going to be a problem. However, what he did at first was to check me. He inserted things. He checked my abdomen. He said, I don't see anything wrong with you. I think you probably should go home then. And then after some time, I went home. After that, he gave me some medications, and that really helped to stop my period. But the next month, it came again, and it was so heavy, and I was almost anemic.
Wow.
What the next thing he did was, okay, this is just probably normal. I'm just going to put you on birth control pills. I said, I don't want to take anything that will alter my hormones. I don't think I'm really okay. There should be something. Can I maybe request for a pelvic scan? Can I request for this? I don't really think anything is wrong with you, but if you actually requesting for that, then you have it. And then I went for a pelvic scan. And there immediately, the sonographer said, hope you know you have fibroids.
Oh.
And I'm like, how do you mean? I jumped down from the bed. I said, how do you mean I have fibroid? I don't really think, what was this supposed to be about? No. So he scanned it, he saw the sizes and all that. It was really small then, and he was really worried why it's causing these issues, where it's causing me to have like a very prolonged and very heavy period.
Can we just give a little insight about what fibroids is quickly so
Of
people
course.
are aware?
So fibroids are like non-cancerous growths that grow around the uterus of a woman. It can grow in it, it can grow outside the walls of the uterus, and then it can grow like it can attach itself just around the walls of your uterus as well. And
That's what causes the heavy bleeding and really bad pelvic pain and also frequent
urination
trips to the toilet.
of
Yeah.
course. So fibroid is like it just is so multifaceted with the symptoms it gives you. There's just a lot of women that have complained about different symptoms. For me, what I've been facing has been like very severe bleeding.
Yeah.
When my period comes, it's like a tornado. It's just so terrible. And then with that kind of loss of blood, you become anemic.
Yeah.
Okay, my GP called me the other day and said, your blood work came back and you're really, really anemic. I need to put you on iron supplements and all that. And then the lower back pain that comes with it, your legs are always paining you, your pelvic area is paining you. You have this frequent urination because sometimes the fibroid goes close to your bladder, and that makes you to always feel like, emptying your bladder and using the toilet.
That's interesting.
Yes.
Okay, so should we go back to the story? Just thought I'll give a bit of a
Okay.
explanation about
Okay.
what it is.
Okay, so when I found that out, I was really shocked because I don't know what this is about.
Yeah.
I've never encountered something like that. I've heard women who have fibroids that it causes them infertility, it pains them and things like that. But I have never like sat down to research about that. And what I did was I went home and I started researching about it. I was like, oh my God, is this why I've been facing this over the years?
Yeah.
And every doctor I meet will be like, oh, it's just normal, you know? There's this dismissal of symptoms that some people experience, and I have experienced it as well,
Yeah.
especially women. They tell you, oh, it's just normal, it's just your period, it's just every woman goes through.
Yeah.
So I grew up thinking my period is probably supposed to be painful. It's really, really supposed to be painful. So I brace up for it and all that. But this is not just enough. The tiredness, the fatigue, the frequent urination, the mental health, how it affects my mental health. Sometimes I'm like, I don't even understand what I'm doing. It's just multifaceted that I can't understand. So when the sonographer diagnosed this, like when he saw this and he said, this is fibroids, I'm like, is this the reason why I've been having all this? And
Yeah.
then during my research, I found out that, okay,
Kind of all
this
makes
has,
sense.
yes, this has been the issue I've been facing for years. And the doctors has been telling me this is normal with periods and all that.
Yeah.
So it just goes on and
Yeah.
on.
Wow. Can't believe how much women go through. Honestly,
Yeah.
it's tough out there.
Exactly.
So when you went to the health professionals before, you told me that there were some doctors that dismissed your condition.
Okay, so before now, when I go to like assess medical care and I'm like, okay, this is what's happening to me with my periods, this is how I feel every day, they'll be like, okay, I'll just take paracetamol, you're going to be fine. And over time, it's just, but this is not really, it's not really addressing the pain I feel. Paracetamol just addresses the immediate pain, but it's not addressing the root cause
Yeah.
of what I'm feeling. However, I met a better doctor and she tried as much as possible to really understand what this is about and all that. And she found that she sent me to go and do a pelvic test and it came back and said, okay, this is actually fibroid that you have. So what she did was she tried as much as possible to refer me to a gynecologist. She said, okay, so if you're looking for MRI, what I'm going to do to you is you have to wait for 6 months to assess MRI. And after that, you're going to wait 6 months to come to me. Girl, 1 year.
1 year.
To see a gynecologist, and every month I'm losing so much blood. And in my file, you could see, like my blood work came back. All my reports is showing that I have severe anemia.
Yeah.
That I'm having lower white blood cells and lower hemoglobin and things like that. And you're saying I wait 1 year to see you and all that. So those are the things that I have experienced over time. I feel for women who are not probably from here originally and women who find it maybe difficult to communicate in English language, what they're going to be facing in the hands of a professional like this.
Yeah, exactly. Like they're supposed to be trained to not have an opinion about the patients, especially like it can put them in such a bad position afterwards.
Exactly.
So it's awful.
It's
Sorry
really
that you had to go
awful.
through that.
It's really awful.
Yeah. Thank you very much for sharing your experience. It's very important to talk about this openly and make sure that women don't suffer in silence and that they're not misguided by, using ChatGPT. We all know students use that a lot. Or just using Google even. It's not always correct. But going on to that, shameless plug, I have a grant with the Women's Health Network and they have registered medical advice that is accurate and is given by doctors. So you can have a look on their website for any questions that you have about your health. It's just the Women's Health Network. Just type it in Google and you can get proper advice about your periods and your health. But back to the podcast. So I wanted to talk a bit more about how common all of these different challenges that women go through are, such as fibroids, like we already said. It is so common in Black women and South Asian women because they're more likely to develop these tumors. And it's often in like a young age where they're very vulnerable and they don't understand that this is what it is and it's quite a serious issue and doctors won't they'll just dismiss it as normal period pain. But there's also endometriosis, which is a tissue similar to the womb lining that grows outside the uterus.
Yeah.
And so that causes, again, severe like period pain, pelvic pain, infertility even, and really heavy bleeding. It's often just misdiagnosed, again, bad periods or just irregular period pain. Yeah, it's crazy. Yeah,
You know, everything that happens to women, especially to doctors who don't really understand or who are not really professionals, they'll tell you periods are painful. I mean, a lot of women experience it.
especially the men. They don't even know what period pain is, but they're ready to say, "Oh, it's just normal." They've never experienced it, but if somebody turns around and said, "My periods are so heavy, it's so painful," just use paracetamol, ibuprofen.
Exactly. It doesn't
just a
address the
period,
root
yeah.
causes.
They'll just be like, "It's just a period."
And do you know, over time, when you live issues like this, it becomes exacerbated. Like, it gets worse.
Yeah, it just
It
gets
doesn't heal
worse.
itself.
Yeah.
It gets worse. For fibroids, it just gets bigger.
And the
It keeps getting-
diagnosis, it takes so long to get diagnosed with this sort of stuff. We also wanted to touch upon PCOS. So this is hormonal imbalance that affects the ovaries. It causes irregular or absent periods, excessive hair growth, acne, weight gain, and infertility, which is one of the main like issues that a lot of South Asian women deal with.
Do you know? Let me ask you. Do you know? You see a lot of women growing hair around where they're not supposed to grow,
Strange
like
places,
that's also one of the symptoms of PCOS. So
Yes.
it's like hystericism, where they grow hair around their beds, and then there's just hair on their faces
Yeah.
and all that. And sometimes they don't even have a lot of hair on their hair,
Yeah.
but they just have hair in where men normally have hair. And
This is exactly what I was just going to say, because I went to the doctor a few years ago because my periods have always been irregular, and so I thought maybe it was PCOS, and they just did some blood work and said my like it's just normal, like all my blood work is normal. So I still don't know whether I have PCOS or not, but I have all of these symptoms for it. And right now the main thing that I've been doing is changing my health myself, because the doctors take way too long with this sort
so
of
you're
stuff.
taking charge of your health by yourself?
Yes,
Of
because
course.
what they did, they just gave me birth control.
Oh my god.
Birth control is always the answer with the doctors. It's always just take birth control and you'll be fine. For a few months, I was fine. But then, like, it just went back to normal. It was because it's so hard to take them on a regular basis at the same time every single day. Make sure you stop after the 28 days. Make sure then, like, you wait till after your period to start again. And it's like this whole cycle. And if you take it at the wrong time, then your period can come at the wrong time, or it might not come as heavy. Yeah, like it might not come. It might be too heavy or too less. There was so much things to factor in, and also like I don't have a sex life, so it's like there was nothing that I needed to worry about in that area.
Of course.
But they just said birth control, and so I tried it for a bit, and then I was like, I'm done. Like my mood is like all over the place. I'm always upset, I'm always annoyed, and I'm so uncomfortable when I sleep. Like there was so many little things that were affecting me, and I said, that's it, I'm done. And then I just took charge of my health instead, because that is the best way to go about health struggles, is changing what you eat.
You're the one that knows how you feel.
Yeah, like you know your body. And so what I did was I stopped eating outside. I stopped eating fried food. I don't eat anything that's fried at all. So replace kind of butter with avocado, for example, because
Great.
avocados are so high in fat, but
And
it's healthy fat.
omega-3
And it's so good for your health. And so replacing things like that helps you more than birth control.
Exactly.
I would never recommend birth control to anyone.
The issue at all times is that with birth control, a lot of women, even from researchers, have shown that a lot of women go through a whole lot with birth control. The weight gain,
It's insane.
A lot of women have controlled, they've complained, about gaining weight with that, and then the loss of hair.
Yeah. You should see the amount of hair I have on my head. I'm practically bald.
The issue is you lose hair on your head, and you are gaining hair in
everywhere
other places.
Everywhere else. It's insane.
Which is not supposed to be. And then also the infertility for like doing long-term usage of that.
Especially
and all
when
that.
you're young.
Your mood.
Yes. Oh my God. But when you're young and you think to yourself, I may never have babies. That's scary to
Oh
even
my
think about, you know? Like,
God.
if the doctor turns around and says to you, oh, yeah, you might have PCOS, in your head, you're going to think to yourself, does that mean I'm never going to have a child in my entire life? As a woman, I know when I was younger, that was the one thing I was like, most women are sure of wanting a child at some point in their life.
Yes, yeah.
I don't know if I want to anymore. Now that I know more information about like everything to do with having children, it's like maybe it's better if I don't, because the whole process is a lot. Women go through a lot when they have a
Of
child.
course,
Yeah.
of course. And then with all these issues, with every pregnancy, sometimes when I'm making some researches and I'm seeing that, oh my God, it's a pregnancy that made this woman like this.
Yeah. Oh my God, people lose their teeth.
I've seen someone that lost her 2 legs because of sepsis. Her child died inside of her,
my
and then
God.
she lost her 2 legs. They had to amputate her legs because of sepsis and all
Women go through so much shit.
every day I make a research about, childbirth and all the issues that women face. I'm like, oh my God,
Yeah.
am I sure about this?
Exactly. Do I really want to go through that? And then, like, my whole body is going to be completely different. And then I'll have to learn to be myself again or be a new person with a child. It's a lot to think about.
Exactly.
And the internet does not show the other side of it. The internet just shows the pretty, oh, look, now there's a baby after 9 months. Not the struggles that you went through throughout those 9 months. And then afterwards.
Even postnatal struggles as well. There's also like postnatal depression and all that. I think women issues need to be, we need to speak about this. We need to talk about this. There should be like loads and loads of laws and policies in place to protect women, especially, around their health issues and all that. Sometimes I feel like, okay, a lot of people are also doing advocacies and awareness and also pushing for policy changes that would accommodate women and even in their workplaces. However, when you look at the prevalence of this, you find out that it's not really enough. It's not really enough. And then we just need to do more. So at any point in time when you come across a woman or a girl child trying to champion causes related to women's issues, please find a way to support them.
Yeah.
Find a way to support, because
This is for the males out there.
for everyone, even
Yeah.
for your own fellow women. And then another thing I also understand is that there's no need for us to work in silos. We have to come together to work together for us to like have a voice. And if you're pushing back, if you're pushing for maybe a policy change, you need numbers. Sometimes these are not things that you can do alone by yourself.
It might sound a bit corny, but there
So you
is
need that
strength
collaboration.
in numbers. There is
Yeah.
always going to be strength in numbers.
Exactly.
Okay, the last issue that I have had a bit of look into, it's not the only other issue, but it's PMDD. It's not talked about a lot. It's premenstrual dysphoric disorder. So this is when women have severe mood symptoms before their periods.
That thing happens to me, girl.
The mood
I think it happens
swings,
to everybody.
Yes, the mood swings are insane. Sometimes I'll be so angry, I'll vent it out at the wrong people, and then I'll be like, sorry, I didn't mean that. It's so difficult.
Do you know? I try as much as possible. Like few days to my period, I find out that I'm not really happy. My mood swings are like top notch. I'm always lashing out, and sometimes you're like, this woman is rude, but I mean, you don't know what she's going through.
Yeah, exactly.
Sometimes your body is preparing for the worst, and then it just creeps up on your emotions. It creeps up on your mental health.
And sometimes
it
you
creeps
don't
up on
even
even your
realize,
physical health and all that, because your body is changing. Your body is using hormones. It's preparing you, for your period and things like that. So I'm not trying to excuse bad behavior for some people, but the issue is that there are some things that you can't control.
Yeah.
There's some things you can control. And then the best thing is about creating awareness about this so that you're prepared well to tackle this issue, to keep yourself together.
Yeah,
if you don't really know, you do, things you're not supposed to do. But if you are versed about that, if every girl child, every woman understands that this could be premenstrual dysphoric disorder, this could be this, you prepare yourself.
Yeah.
You know that, okay, I'm not supposed to lash out. You probably practice self-control and things like that.
Not texting the wrong person at the wrong time.
So, this is where awareness comes into play.
Yes, 100%. But a lot of people are not aware.
Yeah.
Like that's where it comes to. It's like that general stigma and taboo around talking about periods. And I want to at least make the campus a safe space to talk about periods.
Yeah.
Because it's very, very important to know that you are supported as a woman
Mm-hmm.
with your periods, and that like the more people that are aware of it, the more things can be done about it.
Mm-hmm.
What piece of advice would you give somebody who thinks that they might have one of these conditions, but they're not 100% sure?
From everything I've gone through,
Yeah,
the first thing I would say is go to your doctor.
always.
And then the second would be seek a second opinion. If you feel your symptoms have been dismissed or you're not being understood properly, I think you should seek a second opinion.
Yep.
Ask for a specialist.
Mm.
Ask for pelvis scan. Ask for a transvaginal scan. Ask for things that research. Take your health. This is you feeling this. You might not be able to communicate how you feel
Yeah.
to another person, to your doctor, to your GP. But if you feel this way and you research about why am I feeling this way, could it be this? It will also guide you to know the kind of tests that you should be requesting for.
Mm.
So advocate for yourself as well. Seek another person's advice, seek another doctor's advice. If your GP tells you this, I say, okay, can I see a gynecologist, please?
Yes.
Politely request for these things, politely request for tests, politely request that, okay, I feel this is how I'm seeing, I feel this is how my body is doing me. I don't know, but this is how I feel. Can I get maybe a scan about this? I understand that there are also a lot of people that they have to attend to, but I think one of the mission and maybe the vision is that everyone counts, every life counts, every patient's life counts. So yours should count. You should also take your health by yourself, while also advocating for yourself as well.
Yes, 100%. Don't eat all that rubbish food.
Oh, that's first of all, okay, even like before your diagnosis or whatsoever, and then you need to take care of yourself. Girls, I'm telling you, girls, women, we need to take care of ourselves.
Your
Avoid
body
those-
is your temple. That is why.
This is you. The first image we see about you, we know, okay, we're souls, we're living in a body and all that. But the issue is that nobody sees your soul.
Yeah.
Nobody sees your spirit. It is you. It's how you present your body that we see you.
Yeah.
So if you present your body filled with junks and all that, that's how your body is going to start reacting.
Yeah.
So maybe try a diet change, exercise, eat better food, avoid junks, and also remove negativity from where
Negative
you
energy,
are.
yeah.
Anybody, anywhere you see negative energy, please avoid.
Yeah, just get rid of them.
Avoid.
Not get rid of them, not kill them, but well, you can just get rid of the people that make you not feel good about yourself out of your life.
Mm-hmm.
It's difficult. It's easy to say, not as easy to do, but it's one of the most fundamental things that you can do for yourself as a woman to take care of yourself, because the people around you are always going to affect the way you think about yourself.
Exactly.
And it's important to surround yourself with women who are supportive and build a network around yourself where you know you are safe.
Yes. That's one of the things I also wanted to talk about. Join the women's network, build collaboration.
That's why I have monthly sessions. Yeah, so come along to my monthly sessions too.
Of course.
Yeah, it's like a women's group. It's great. It's wonderful. Like, it's just an opportunity for you to sit down, vent about like anything that you're dealing with. Let me know what I can do as your women's officer to support you the best I can. In whether it's needing pads or tampons in specific areas, I will vouch for you and I'll make sure that happens. Whether it's you're just struggling that week or you've had a hard few weeks and you just wanted somebody to talk to, I'm here.
Of course.
I'm your big sister.
I'm sure you're also doing something about violence against women and girls.
Yes.
Yeah.
So that's like 16 days of activism. Be a part of it. It's very important that we stand together and show that we women can walk outside in the dark and not be afraid of men being attacked.
Exactly.
Like men catcalling you in the streets, when you're walking. We should be able to walk out safely. So join us as well on the 10th of December, where we'll be doing Reclaim the Night, and it'll be a march to the city centre with all the most influential people at the university, such as the Chancellor, the Vice-Chancellor, the Pro-Vice-Chancellor. We have a lot of people that will be coming, and hopefully more. The more people that we can get to be aware about Reclaim the Night, about the issues that women go through every single day, the more we can prevent it from happening. And that's essentially what I'm here to do, is prevent the bad stuff from happening and make sure that more good goes around, especially on campus.
Yeah, I'm also going to be coming for that event as well, because
Yay.
I'm really very passionate about what women's societies and women networks are doing across the UK and even across the world as well. I feel like if we band together at all times, we're able to, achieve a lot. I'm really proud of you, girl.
Oh, thank you. We're
I'm really-
also going to be doing
Of course.
our event. Yeah. So you
So,
reached out to be a part of, for me
yeah.
to help be a part of your events. Do you want to talk a bit more about what those are?
Yes. So I am collaborating with the women's officer here at the University of Bradford, who I have beside me, Kamal, and we're planning a fibroid event. We're trying to, have an event that, silences fibroid. So we call this silencing fibroid. It's going to be about awareness, advocacy, and also seeking for policy change about things that relates to fibroid and other women's health issues. So we're looking at having this. We're going to be having it in like different phases. So for the first phase, which is going to be like a webinar, so we're looking at having it on the 21st of November 2025. That's like a few weeks from now. So we're going to be having a webinar around fibroids and other women's health issues. So we're going to be sharing details of that as well with you. And the second phase of it is going to be a work. We call it Unmuted. It's going to be a work to like showcase awareness about fibroid and other women's health issues as well.
So that'll be like a similar kind of march, like
yes.
Reclaim the Night.
Yes.
So we'll go out there and basically have a peaceful kind of march
towards the city center,
centre,
the
yeah.
centenary, and then we're also like inviting a lot of speakers, and then we're also like involving the NHS and all that, because at the end of the day we're also looking out for like better treatment and treatment pathways for women. And then that is going to happen on Thursday the 27th of November as well.
Hopefully. Fingers crossed.
And then the third event, which is like the phase 3, is going to be like the fibroid conference. That is where we have silencing conference. So we're also going to be like having a lot of experts in the room. So you should also come along. We're going to have experts in the room. We're also going to be inviting NHS. We're inviting doctors, gynecologists who are experts in this. And we're also inviting women who have lived experiences just like you and I, to talk about the issues that we face around fibroid and every other women's health issues. So it's going to be amazing. It's going to be a day where everybody gets to understand. It's going to be also like a channel for advocacy for more better referral pathways and all that. So we're also looking at phase 4 being like, having like a support group, just like Kumar had spoken about, have a support group for women who have issues like that. Have you thought about this? Should in case you get something like treatment, maybe a surgery, would you want to have a support group that will tell you, okay, this is what you do, or even maybe check on you at your home or maybe in the hospital and all that? So this support group is going to be sharing, amazing tips. Like it's going to be very, very holistic for women who have these issues to also share their experiences, talk about how we can, come out in numbers to also like push for a policy brief to foster better access to healthcare for these women and all that. So it's going to be something very, very holistic, and we're really, really looking forward to all of you to come around for more collaboration, for to also share in our awareness and advocacy campaigns and things like this. So looking forward to see you.
Great stuff. Do you think that there are better things that we can do for Black women to access better healthcare?
Oh, yes. I think one of the things I am looking forward to is to ensure that, first of all, there's awareness about these issues that Black women face. So from studies, you can see that there's so much prevalence of fibroid in Black women. From studies, you can see that we're like 80% more disproportionately affected by fibroid.
Wow.
PCOS also affects Black women the more. A lot of these health issues actually affect Black women more. I wouldn't know the reason. I am not an expert. I'm not a doctor. But I think that we can do a lot to ensure that they access healthcare better. Like they access better referral pathways, and then also faster and easier access to healthcare. And one of those things is at least to create awareness about these issues. A lot of people do not know that Black women are disproportionately affected, first of all. And the second one is to ensure that at least they are also getting access to experts who can also diagnose them and also foster treatment. And then the third one is to, ensure that, they probably also understand that aside these things happening to them, there are other women who suffer from this. Other women from other races also suffer from this. So they are not, well, nobody is alone. You're not alone. There are a lot of, there's the British Fibroid Foundation. There are a lot of women health organizations that support women. And, there could be like referral pathways to them. So the three things I have outlined is for them to also understand the things about this, get awareness, understand that this is what is happening to you. And the second one is to understand that you're not alone. There are a lot of women group that can support you. And also, whatever journey that you are on, whatever diagnosis you're giving, maybe write those things down. Journal that.
Yes.
So that when you're speaking, this is what I faced when I was going through this. You can say, on so and so date, on so and so time, this is what I was told by a doctor and things like that. So if any part of it is relates to maybe what you feel other people are not going through in their access to healthcare, you can confidently say that this is what I went through, and I have my journal to showcase that this is what I went through at that point in time. And then also understand that there are a lot of help out there. Seek for referral pathways, seek for women-led organizations or women health organizations where there are a lot of women who have experienced this to also guide you, share your experiences, and also look out for how you can get access to maybe experts, things like that. So I think Black History Month is a very, very good time for all of us to, have a roundtable, sit around, talk, have an awareness and advocacy campaign around it, and also find solutions together.
Women unite.
Yeah.
I have a little statistics section. Just let some of these statistics sit with you for a bit. So diagnosis delays. On average, women with endometriosis wait 7 to 8 years for a diagnosis.
That is terrible.
That is insane. And then, like you said, fibroids in Black women, up to 80% of Black women can develop fibroids by the age of 50.
Exactly.
Compared to 70% of white women, often with more severe symptoms.
Of course.
PCOS affects 1 in 10 women of a reproductive age. That's like as soon as you start your periods for the first time.
It's not easy.
It's so scary to think about that. 1 in 10 people. You could sit with a room full of 100 women and 10 of them will have PCOS.
We need to do more, girl. This is a wake-up call.
We do need to. This is definitely a wake-up call. Another one is the stigma surrounding menstruation. There's a lot of cultural taboos around menstruation that often stop women from seeking help. And there are a lot of advocacy groups that can support women, such as Endometriosis UK. There's Verity, that's for PCOS, and the Fibroid Foundation, like you mentioned before. So, yeah.
Yeah, I just know that there's just also like a lot of women's organizations who can, support. And just like what we are trying to do in November, we're also like creating like a support group for women who have these issues to come together to share their experiences. It's going to be like a holistic support where we can have people who are very versed with yoga, who are dietitians or nutritionists to come and share tips on how you can, go through this journey. Maybe if you are getting surgery, how do you go through this journey? So it's going to be like a very holistic support group where women come together to like support themselves, to help themselves go through life together and all that. So it's not just going to be basically for people who are suffering from one women's reproductive issue or another. It's going to be a holistic support group where, you share your experiences. We could, take this further to, other aspects of life, the social life, your health life, and things like that. So we're just looking forward to loads and loads of, support, collaboration. And just like we've said before, if you see any woman or any girl child trying to champion the causes of women and girls, try as much as possible to support them.
Yeah, that's the main thing. I have 2 more questions for you before you go.
Okay.
So if you could change one thing about how society views women's health, what would it be?
What I would change is, first of all, unbundling the taboos and the stigmas that, this has to come with.
Yeah, periods.
I understand that in different religions, they see menstruation, first of all, as a taboo.
Yeah.
And that stigma
as
sticks
something
with it.
bad. Yeah.
And people, because of that, even women themselves don't get to talk about this.
Yeah.
But menstruation is something that is natural.
It's
It
natural.
occurs
It's
natural.
normal. Like that's what
The
makes
cr-
you a woman.
I mean, the creator put these things in you. You didn't request for it. And because of that, I do not think we should be shy
Yeah.
or there should be stigma attached
Or
to
even
it.
any shame because it's so normal.
Exactly. I do not think we should be ashamed to talk about it. So that is number one thing I would look at,
Yeah.
addressing or maybe changing. Remove this taboo, remove the stigma that has to do with menstruation. Let's talk about it.
Yeah.
Let people talk about it freely.
Wave those pads around.
Of course, if you go to buy pads, they try to shove it in your hand and,
Yeah.
tie it very properly. If you go to, but I mean, it's something that occurs naturally and we should talk about it. So that's one of the things I will change. The second thing I'm going to change is dismissal of symptoms that surrounds a menstruation as
In
well and
healthcare,
women's
yeah.
health. Especially in healthcare and even in other circles.
Yeah.
You see a lot of people when you're saying, this is what I'm going through when I go through my menstruation, and they tell you that, oh, it's normal. It's not normal. Painful menstruation, painful periods are not normal.
Yeah.
From my research, I've found out that it's not normal. It's not supposed to be as painful as people are purporting it to be.
Yeah, like some women will stay in bed all day and their parents will be like, why are you not downstairs? Why are you not doing this? Why are you not doing that? And it's their period and they're like, why are you blowing it out of proportion? But in reality, it's
This is
that
what
bad.
yeah, exactly. So that's like the second thing, the dismissal of symptoms that comes to it and all that, and even the dismissal of symptoms that has to do with women's health. I mean, I do not know how we came about this, that as a woman you need to struggle about your health. As
You
a woman,
definitely
you just
don't
have
need
to,
to.
you just have to go through it because the other women are going through it. Who said that?
Exactly.
Who brought that about? This is not how it's supposed to be. So that's like number 3 thing I'm also looking at, changing. Number 4 is how the society views women. You would agree with me that sometimes as a woman, the society probably sees you as lesser.
Yeah.
Well, I'm not lesser.
No.
We are not lesser.
In fact, we might be better.
From inception, we've shown so much intelligence, so much grace, so
many women have done so much for the world.
Exactly. So we're not lesser. We probably have a lot of women are strong, because I would have said, maybe we probably don't have a lot of energy, but we do.
We do. We walk around on our first day of our period.
Of course.
Nobody will know the struggles of that.
You can't be losing how many liters of blood or mLs of blood.
You'll still be running
and then
around.
You'll still be running around, and you'll be expected
to
do all the chores and activities that you've been used to and all that, and you're doing that with so much grace. It's not easy.
I was going to say, behind every successful man, there is always a woman. Always.
Well, there should be behind every successful woman. I mean, men should always sometimes stand behind us as well.
Yes.
I mean,
that is powerful.
Yes,
definitely.
very.
And the last question that I have for you, I ask this to every single guest because I love this question. What is one piece of advice that you want to give to people to take away from today's conversation?
Okay, so the first piece of advice I would give to you is take your health seriously. Number 2, advocate for yourself. When I mean advocate for yourself, when you go to your doctor and you feel like your symptoms have been dismissed, can you say, I'm so sorry, I would want a pelvic scan? I'm so sorry, can you send me to an MRI? Can I have a second opinion?
Yep.
Politely.
And don't be sorry about it.
I mean, you can say, I'm so sorry, but I don't believe that my symptoms are just painful periods because I experience more. But can you refer me to a gynecologist? Can you refer me to do an MRI? Can you refer me to do a pelvic scan and things like that? So first of all, take your health seriously. Number 2, advocate for yourself. Number 3, find a sisterhood. Find a women's network, join them.
Yeah.
There's strength in numbers. There's always support out there. Women are actually supporting other women. When things happen, they say women supporting women, So find a women's support network and join them and, share your experiences. And number 4, do not see yourself as less. Whatever society has implanted in your head, it's that you're lesser than whoever. That's not true. You can do it. You are top notch. You are excellent. You're passionate. You're a great person. And I want you to see yourself as that. And no matter how you look like, no matter where you're from, no matter your ideologies and even your idiosyncrasies, I just want you to know that you're amazing. The fact that you're a woman makes you exceptional. And you are doing very, very well. Thank you very much.
Thank you. That was amazing. Thank you very much for joining us today. Your story and the work that you are doing is truly inspiring. For anybody listening, if you're struggling with your period health, please know that you're not alone. You are allowed to seek help, and you are allowed to feel the way you feel. And that is a wrap for today's episode. Remember, everybody has a role to play in shaping our society, and the journey does not stop here. Keep questioning, keep learning, and keep on making a difference. Thanks for tuning in, and we'll see you next time on Her Side of Campus.
Thank you.